I'm Bakri Hammami. I'm one of the fellows at Moffitt Cancer Center. We're here at ASH 2025. We're presenting our work on CAR-T outcomes in patients with Richter's transformation. As we know, CAR-T has been a cornerstone of diffuse large B-cell lymphoma for a while now. We've had excellent responses. However, when we substratify by patients who have Richter's transformation into diffuse large B-cell lymphoma, those patients are not doing as well as the patients who have de novo diffuse large B-cell lymphoma. So in this study, what we tried to find out is we tried to stratify these patients and find out from their tumor biopsies if the tumor microenvironment of Richter's transformation plays any role in why they don't do as well as de novo DLBCL. So what we did is that we collected all the patients who had CAR-T therapy, patients who had de novo DLBCL, and patients who had the Richter transformation DLBCL. We ended up with 15 patients with Richter, 18 patients with de novo diffuse large B-cell lymphoma. We collected all the clinical data and we found that the baseline characteristics overall are the same. We used axi-cell more for the de novo, and it was more distributed between axi-cell, lysocell, and T-cell for the Richter transformation, but otherwise all the other characteristics were very similar. Now when we looked at the response rates, the clinical response rate at the 30 days and 3 months, we noticed that at 30 days or at 1 month, the responses are very similar in terms of the percentage of the overall response rate, but the duration of it is not sustained for the patients with Richter's transformation. And so when we tried to find out why, so one of the studies that we did is a flow cytometry where we looked for exhausted T cells, and we found that patients with Richter's transformation have higher percentage of markers that are associated with T cell exhaustion, including PD-L1, TIGIT, and LAG3, etc. And we show it over here and over here, even in central memory T cells. We also wanted to validify that information by doing RNA expression analysis, and we found the same data, basically just correlating with what we found on the flow cytometry, where the markers, the gene markers of the gene expression data from the markers for exhaustion are also elevated in Richter's transformation. And then we found that the overall model for exhausted T cells was higher in Richter's transformation compared to diffuse large B-cell lymphoma. And so that's our